This is a very important discussion, and I've spent hours literally thinking about this. And this is why, for those who normally watch me, I'm like 2 hours out of my normal schedule because I had to take so much time to reflect on the implications of what I'm talking about here. You may think what's important about hair loss, which is alopecia. It's not the hair loss, it's the importance of what the science means about the hair loss that is so very important. Now, what I'll be making reference to is another one of those breakthrough papers, again coming out of Korea. They seem to be producing some pretty high quality research, and they are not afraid to ask hard questions. And in this paper, they were looking at broad spectrum adverse events of special interest based on immune response following COVID 19 vaccination, a large scale population based cohort. Now, there are a lot of important things in this presentation or in this paper, but I am zeroing in on one specific thing, which is alopecia. And what they have related in this paper is that alopecia explosion. Now, when we say an explosion, we just mean a doubling or trebling of the cases. That's very significant when you think of it in terms of numbers. But because alopecia only affects a small number of people, we're talking like 0.1 to 0.2%. So if you have a city of 100 or a town of 100,000 people, 15 to 20 people will have alopecia. Now, what we're talking about is that if that 15 to 20 people becomes 30 to 50, the people who will notice it are in the dermatology clinic. It's not going to be that you're suddenly going to see all your friends and family losing hair. But as I said, it is not so much about the alopecia, but it is what it means from an immune point of view that caught my attention. This is why I reflected on this for hours. I don't think you know how much time goes into the research. Don't think this is easy. It's very complex, takes a lot of time, and I hope you appreciate it. And I guess you tell you how you will show me. Make sure that you like, make sure you subscribe, make sure you comment. This information here is being shared with you freely. So let's get now into the science, because in order to understand the paper, you have to understand a little bit about the science. But here are the big numbers that the paper was showing us. So when we look at this paper, as I said, this is coming out of Korea here. And they were talking about the fact that the adverse events related to COVID 19 vaccines have been primarily on life threatening side effects. However, there are a lot of other side effects that are more common, but not necessarily as exciting and therefore remain underreported and insufficiently investigated despite their potential impact. So remember, when anyone tells you that all the research has been done, come on. We are only starting to uncover half of the issues here, and this is why I keep talking about it. So, what they did was quite simple, is that they looked across 4.2 million people in Seoul in South Korea, of which they then found 1.45 people who are million who are vaccinated compared to 289,000 non-vaccinated. Then they excluded any underlying diseases. And what they found is that at 3 months, these adverse effects of special interest were significantly higher in vaccinated subjects than non vaccinated subjects, except for endometriosis. And they found that when you combine the vaccines like AstraZeneca and Pfizer or Moderna, this had the highest increased risk of most of these adverse effects. So they're saying that this is just a flag, as usual. It's not, as you always hear, correlation is not necessarily causation, but it's an important flag that needs to be investigated. So why am I talking about it now? Is because there's an important part of this presentation or this paper that caught my attention. When you look at the numbers, And I'll show you this here so that you understand what it is that I'm talking about. They looked across a number of less interesting topics that can often get overlooked. Now, you may not be able to see all of it here, but they covered everything from menstruation, abnormal bleeding, bruising, zoster, visual impairment, ringing in the ears, middle ear infections, a whole range of things. And what you have to remember is that this line here represents the point at which, if you are to the right of it, it means increased risk. If you are to the left, it means less risk. And you can see across the board, every one of these things has higher risk in the context of the vaccinated cohort, whether or not they had a combined or just mRNA or just the, say, AstraZeneca. The one here that caught my attention was the alopecia. Now, it's increased risk whether or not it is mRNA or the AstraZeneca. But the combination, thing to say here is that, and I don't think you can see this easily. Oops, let me go back. I'm going to have to make this a little bit bigger so that you can get an idea as to what's happening here. So you can see here that with alopecia, and I'll make it even bigger, with alopecia here, it is at 3.74 hazard risk at 1 week. So this first bar or this first column is 1 week. This is 2 weeks. This is 1 month. And this is 3 months. And you can see that this risk of alopecia remained largely consistent throughout the whole duration. And as I said, there are many other things to look at. The other one I'll tackle at some point is this 6.7 times risk of visual impairment, which is really high with the DNA vector-based vaccines. Not sure why, but we are focused at the moment on alopecia, and there I'll explain to you the reason why I've taken this one to focus on. As I said, the premise is that these are side effects that are not studied so often because they're not so exciting. So with alopecia or hair loss, let's just go through a few slides to help you to understand the science. So the first thing you have to realize is about your hair. And this is what it would look like: a hair follicle. Down at the bottom here, the melanocytes is what gives it color. And this is the bulb where it continues to replicate, and then the shaft as it grows up, and it goes through this bulge here, and then it goes out through the skin, the scalp, or wherever it is. And then you have glands producing oils. Now, what you have to notice is that this area here that is kind of blue around this hair shaft is what they call immune privileged. What it means is that it's completely separate from the rest of the body. And the reason is because if the body identified or the immune system identified any of this, it would attack it. And so fundamentally, that's what alopecia is around. It's essentially when that immune privilege, for whatever reason, is lost, the immune system then will attack the hair, the shaft, the bulb, destroy the cells that are replicating, and then the hair is unable to grow and you have hair loss. And that's the fundamental thing. So it's important to note that alopecia is an immune-mediated disease, unless it's related to, say, chemotherapy. Chemotherapy causes damage to them as well, and you can lose your hair. So this is the basic premise. Now, the second thing that I need you to understand is the principle of regulatory cells. This is what got the Nobel Prize this year. The principle or the knowledge around the regulatory cells, T regulatory cells. How it works in terms of immunity is that just like what happens with your at your elbow, say for instance, you have the triceps at the back that extend it, and you have the biceps that flex it. Your body always has a balance, action and reaction to keep things in balance. And in the same way, you have this inflammatory balance where you have effector cells that want to fight and cause inflammation. And then on the other side, you have regulatory cells. These guys try and keep them in check. And when you have this ongoing balance in place, you don't have disease. Okay? And that's largely because the regulatory cells are keeping it in check. Very important point. And these T regulatory cells, as we said, have gotten the Nobel Prize this year because we're starting to realize that it's not just about effector cells. How do you switch them off? You need regulatory cells to keep things in check. So, what happens in COVID and COVID vaccination as well is that autoimmunity, because of particular parts of the spike protein, they bind to something on these regulatory cells, neuropilin, which can dysregulate them. So they're no longer as effective. So this is kind of like what I have as a diagram. So this damaged T regulatory cell then becomes dysfunctional. So in effect, it's not working as well. And this could be because of a number of things: infection, vaccination, exosomes from other immune cells. It then damages these T regulatory cells. Now, when these T regulatory cells get damaged, what then happens is you have an imbalance because your effector cells are still going. And it would look something like this. Suddenly now, these effector cells are pushing along, and because some of the regulatory cells are just not working, they can't keep them in check. And you then have inflammatory processes occurring which cause disease. Okay? That's the starting point. So this is now how it correlates with alopecia. Now follow this carefully. When it comes to hair loss, remember, as I said, the hair shaft is immune privileged. It's like in a special box, a special office that nobody knows that they're working in there. They're like the, not quite MI5, but they're hidden away. And the immune system doesn't know that they're operating. And this is what allows them to do what they do. So here is what it looks like. And I got this from this paper, an overview of JAK-STAT pathways and JAK inhibition in alopecia areata. And what they were showing here, again, the same principle. The major histocompatibility expression is in this part. So this is where the immune cells can identify antigens and attack them in the skin, just down into the hair shaft at the top here. But below here is immune privileged. They can't get there because all around it are these T regulatory cells. They produce interleukin 10 and they increase TGF beta, and they keep the hair protected from the immune system so that it can continue to replicate. What then happens in alopecia areata is that these regulatory cells are no longer effective, which then allows the immune cells to come in and start attacking the hair shaft. The hair then dies, and then you have patchy hair loss. Follow again. Normally, in your hair, where the shaft is, where it's growing from, it's immune protected. The immune system doesn't know it's there. But if this protection disappears and suddenly the immune system recognizes it, it automatically goes into attack mode and damages the hair. And that then causes the hair loss. Really important point to understand. This is why I said this is such an important principle, because this is what it would look like with alopecia areata. And this is a case report, one of the first ones in 2022 with alopecia areata after COVID vaccination. Immediately within days, he started to lose his hair. And this is the kind of patchy hair loss that you can get with regards to what happens, including his face as well. And this is a a typical case of alopecia areata. In some cases, it can settle. Sometimes you can get the immune system to shut down and the hair can start growing again. But this is the point of what happens. Now, as I said, why am I talking about this so much? And the reason is simple. It's about the principle of immune privilege. What it's demonstrating in that research is that areas in the body that used to have immune privilege seem to be being damaged. So what we are likely to see, and this is what I'll then take you through step by step. I'm just starting with alopecia because it was such a significant episode in the research, but there are other immune protected or privileged areas in the body, parts of the eye, the spots in the testes, where sperm is, with regards to the placenta, protected area as well, blood-brain barrier, in the skull and the meninges, as well in the bone marrow. So what this tells us is that when you extrapolate the science, you can then predict what diseases are going to increase across the population when you have immune privilege damaged in parts of the body. And remember, this is not like suddenly everybody is going to start having their hair falling out. But you have to then realize that if we're going to see a doubling or a trebling of specific conditions, the people who are vulnerable are more likely to get disease presentation earlier. And that's how I think we're going to see it. Many more cases of different conditions are going to be happening in a way that puts pressure on health systems. People will be struggling with the fact that they can't explain why this is happening. But if you have been listening, you will be able to say, well, this is about the damage to immune privilege, most likely in highly vaccinated regions. Maybe inconvenient for me to say this, but this is what the evidence is showing us. And what we're lucky about is that there are parts of the world that are continuing to do the research that should have been done from very early on, because the premise is the same. If you damage the immune system, if you hyperstimulate it, if you damage regulatory cells, you are likely, or you are going to see, an increase in certain kinds of conditions. So remember the principle. Immune privilege is being damaged. My extrapolation is therefore, what diseases can we expect to see down the line? So in order to hear that, you must remember to subscribe so that you hopefully will get the videos when they come up. You have to comment to say thank you so that you help to push it out for other people to see, and you can share it yourself. So thank you very much. Please look in the description for Humming Heroes. This is about protecting your upper airway, because believe me, every round of COVID increases the risk of dysregulating these T cells as well. So you can get the double whammy. Let's find ways to reduce the risk. Have a great evening.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.